Thank you for joining us for week 1 of the Mental Health Matters series. We look forward to our conversation today, as well as seeing you for week 2 and 3 of the series. To those of you who have joined our wellness webinars before, welcome back. We're thrilled to have you. To those who are new to our Connect Care 3 webinars, a special welcome to you. Welcome to What is Your Mental Health Temperature, a Connect Care 3 webinar. Jennifer and I are seeing a transformational silver lining through the experience of the pandemic. Despite so much change and tragedy, people are talking about mental health with less judgment than before. You recognize mental health as another aspect of health. Just as the dermatology team helps you with your skin, mental health providers help your mind and brain. I'm Amanda Vosberg, National Board Certified Health and Wellness Coach with the Chronic Disease Management and Prevention Program. Today, we're looking forward to a discussion that we hope inspires you to take action and integrate healthy self-care practices that will help you improve your mental health temperature despite continuing to live in these times of certain change. Joining me today is wellness nurse educator Jennifer Kalis. You may have had the pleasure of attending one of Jennifer's webinars in the past. If so, you know what an educational and inspiring experience we're about to have. If not, you'll soon find out.
Thank you, Amanda, and thank you for your optimistic outlook that inspires a sense of hope. Hello, everyone. I'm Jennifer Kalis. As a nurse coach and experienced registered nurse with years of caring for the mental health needs of my patients, I am eager to share knowledge with you today. Thank you again for joining us, taking advantage of the opportunity to normalize conversations about mental health, as well as optimize your mental health. Let's get started. Let's look at the 4 graphics on this slide that correlate to 4 life scenarios that depict common human experiences with varying levels of mental and emotional distress. This distress can occur across all ages, all socioeconomic groups, all genders, and all ethnicities. All scenarios could be real. In today's webinar, you will learn there are resources available to cool down these varying degrees of mental and emotional distress and provide hope. With that, I invite you to listen closely to the scenarios and consider which one you most relate to, and maybe which scenario you wished you related to. The first head on the left depicts a person with chaotic thoughts, large feelings, and irrational behaviors. Their mind may believe false statements like, "I'm the ruler of the world," or they may be hearing voices, "You can't leave your house. The spies will follow you wherever you go and maybe hurt you." This person may not have slept for days on end, and they may not be eating at all. They may be having thoughts of harming themselves. They may be isolating themselves, not responding to phone calls or text messages, or not answering the door when a friend stops by to check in on them. The second head depicts a person who is going to work every day, but the intensity of feeling hopeless, guilty, and sad is overwhelming. It feels like they are carrying a load of bricks on their back. They may find they are frequently angry with their partner and children, even when they don't want to be. They may not be eating regularly, skipping breakfast and lunch, and the relentless anxiety makes it impossible to concentrate at work and sleep soundly at night. They may have experienced panic attacks with such severe chest pain that they went to their local emergency room to be sure they weren't having a heart attack. The third head depicts a person whose partner and married son were both diagnosed with cancer within months of each other. Their parents live nearby and they need help with shopping and doctor appointments. This person is doing okay at work and at home, but realizes something isn't quite right. Their work and family responsibilities are just too great to carry alone. The fourth head depicts a person who is juggling work and family responsibilities. When the responsibilities are too great, they ask for help and support. They were feeling anxious when their son returned to college during the pandemic. However, staying in touch with him has eased their anxiety. They walk 2 times a week with a close friend, and they know they are not alone. Their sleep is restful. They enjoy a family game night once a week, and they laugh easily. The family talks about their challenges and joys almost daily during the evening meal. They are feeling content. Which scenario do you relate to? Or maybe you know someone who relates to one of these scenarios. If the scenario you want to resonate with is different from the one you relate to, or if you are feeling your best, I am glad you're here today. Thank you again for joining us. Amanda?
Mental health professionals are concerned about everyone. Over the last year, they've been actively responding to the needs of friends, family, acquaintances, and colleagues, and perhaps even your needs too. To rapidly monitor changes in mental health, the National Center for Health Statistics partnered with the Census Bureau to develop a survey. Results show that the experience of anxiety and depression shifted along with your routines. From 11% of people experiencing these mental health concerns to more than 41%. That's in January 2021 alone. We now find ourselves in March, 1 year later from the onset of the drastic societal change. It's logical that mental health providers are concerned about everyone. Mental health concerns aren't saved for those who experienced childhood trauma or those with poor coping skills. Mental health concerns are seen in all ages. Adults, children, and teens are struggling. Those who suffer with addiction and substance abuse are struggling. Those with pre-existing conditions are struggling. It can be difficult and stressful dealing with life in general, let alone when you fear for your health and safety. The COVID-19 pandemic threatened both your health and safety. In addition, the significant change that ensued as a result of the pandemic turned your routines upside down. Your work life shifted, home life shifted, societal life shifted. You were and presently are challenged in unexpected ways, managing time, growing accustomed to spending time in and near your home, as well as navigating healthcare for yourself, your children, your parents. The significant change in conjunction with the chronic nature of the pandemic-related challenges sets the stage for the vital need of mental health providers, mental health support, and conversations surrounding this common human experience. This is why we've committed 3 weekly webinars to address this concern centralized around mental health in the pandemic. Throughout this series, your perception of mental health concerns will be normalized. You will learn about the brain and mind, and you'll learn actionable steps to care for your mental well-being and cope amongst the pandemic. Your brain is amazing and intricate. It consists of physical structures, chemical messaging transmitters, and varying segments controlling varying activities of your responses, reactions, thoughts, feelings, and actions. The brain is the complex organ of your mind. Without such a complex high level of functioning, you couldn't do the things you do, such as weigh the pros and cons, risks and benefits of decisions, think about the outcomes of your actions, nor innovate, develop, and progress in the way you do. Today, we're going to break down this complexity into a very simplified relationship between two parts of your brain. Before I share, please hold out your hand in front of you. With fingers extended straight, fold only your thumb across your palm. Your thumb represents your amygdala, the part of your brain that serves you in processing your emotions. Next, with thumb across your palm, wrap your fingers over top of your thumb. Your fingers represent your prefrontal cortex. Your prefrontal cortex acts as the CEO controlling things such as complex thoughts, prioritizing, and your responses to the emotional reactions of your amygdala. The first part of your brain that we'll discuss is the amygdala, the little pink structure on the image on the left, and is represented by your thumb. Your amygdala, again, is the emotional processing center of your brain. When someone sees a fire in a building, people fighting, or experiences intense sorrow, they may act before even realizing what they are doing. Waving their hands frantically, yelling for help, slamming doors, even sobbing hysterically, just to name a few. Their amygdala is activated in emotional response to this perceived threat. The second part of your brain we'll discuss today is the prefrontal cortex, the orange image on the right, represented by your fingers covering your thumb. It's the command center for your brain. This part of your brain helps you set goals, pay attention, manage impulses, and make decisions. Can you think of a time where you did something that brought you good results? Even though it may have been scary, hard, or overwhelming at first, your motivation for success, coming from your prefrontal cortex, helped you work through some of those challenging emotions. The communication between the amygdala and the prefrontal cortex is disrupted when you feel threatened or life is altered in unwanted, unexpected ways. When the actions of your amygdala overtake the actions of the prefrontal cortex, chaos ensues. This chaos is explained by Dr. Dan Siegel, interpersonal neurobiologist, in terms of flipping your lid. When your fingers, the prefrontal cortex, expose your thumb, the amygdala, your emotional brain, takes over and you flip your lid. Both parts of the brain certainly have their place, but when one outshines the other inappropriately, chaos ensues. Sure, this chaotic state helps you in times of threat, but during the chronic nature of the pandemic, when the threat has been constant, consequences of this response are seen. This chaos leads to distress in the mind and body. There's a spectrum of this distress. This distress can be experienced with a fleeting disconnect between the amygdala and prefrontal cortex, or it can be experienced chronically long-term. This distress can be experienced at varying degrees of severity, mild or severe enough to cause mental illness. In contrast, when the amygdala and prefrontal cortex work together, integration is experienced. This integration into higher functioning parts of the brain highlights the importance of strengthening your prefrontal cortex so you can enjoy an improved sense of mental well-being and a cool mental health temperature. Jennifer will share with you how the spectrum of varying degrees of chaos and distress is similar to a thermometer. Jennifer.
Thank you, Amanda. As mental health is complex with many intricacies, we'll relate mental health to something much more simple, temperature. A fever is not an illness by itself. Rather, it's a sign that something is not right with the body. It often means there is an abnormal process occurring in the body, like an infection, a serious disease, or it could be a situation as simple as being overheated while playing in the sun for an extended period of time, especially without adequate hydration. As this is true with the body, so it is true with the brain, the organ of the mind. When the amygdala and prefrontal cortex are not communicating smoothly, as Amanda explained, mental and emotional distress occurs. This distress is a sign that something is not right within the brain. Like a physical illness, it is important not to ignore the signs your body is telling you something isn't quite right. Likewise, it is important to respond to signs when your mind is telling you something isn't quite right. Now, there are varying degrees of mental and emotional distress along the mental health continuum. And just like physical health, mental health is not an off and on switch. And just like your body changes, your body temperature changes, so does everyone's mental health temperature change. Consequently, it is important to recognize and respond to signs of a rising mental health temperature, just like you do when you have a fever. These varying intensities resemble different temperatures on a thermometer. As you can see on the slide, they range from healthy, which is no or very mild self-limiting mental and emotional distress, to reacting, a mild degree of distress, to injured, a higher degree or increased intensity of distress, and to ill, a very high degree of distress which requires immediate professional care, just like a very high fever. To be honest, one of the dangers of talking about mental health is that everyone worries they might be mentally ill. Now, before you worry, please listen closely. We all have thoughts and feelings triggering our amygdala that cause us to act a certain way. When these actions do not interfere with daily life, you can be reassured you have a healthy mind. To be clear, a mental illness is a common human experience caused by a disruption in the communication system of the brain, and thereby disrupting thoughts, feelings, behaviors, along with disrupting daily life. As you all are aware, within the context of the pandemic, as well as life in general, the value of caring for your mental health and easing your mental and emotional distress is vital, just like caring for your physical health. Dr. Foray, a Yale medicine psychiatrist, reinforces the importance of monitoring your mental health temperature. She says it is critical to pay special attention to how you are feeling and reacting to any situation. The following slides and discussion on the varying degrees of mental and emotional distress supports Dr. Foray's expert advice. And I invite you to follow her advice. Note what is your mental health temperature and that of a loved one you may be concerned about. Next, I want to explain the varying degrees of mental health in more details. No worries, I'll make sure to cool things down for you. With that said, a high mental health temperature indicates an illness when thoughts, feelings, and behaviors are chaotic and the disrupted brain function causes a disruption in daily life. Remember the person with chaotic thoughts, large feelings, and irrational behaviors, which correlated to the first scenario described at the start of the presentation? This person may be having thoughts of harming themselves or others. They may be believing things that just aren't true and their mind is playing tricks on them. When an individual is experiencing severe emotional distress and is mentally ill, it is definitely time to seek help, just like when someone is severely ill. A severe mental illness does not get better on its own, and getting help is crucial. Now, there is an alarming statistic noted by the National Alliance on Mental Health. The average delay between the onset of a mental health disorder symptoms and treatment is 11 years. This statistic must change. Next, I invite you to note the crisis resources available to treat a very high mental health temperature or mental illness. When an individual is experiencing severe distress, threatening self-harm, or threatening to harm others, emergency care is available 24 hours a day, 7 days a week. Emergency assistance is available by calling 911, as well as going to the local emergency department. If someone is in severe distress, but it's not life-threatening, you could text CONNECT to 741-741 to speak with a trained crisis worker to cool down or to be connected to other appropriate resources. Crisis helplines are also available 24 hours a day, 7 days a week at no cost. These include the National Suicide Prevention Hotline. This helpline offers skilled, trained crisis workers who listen to you, understand how your problem is affecting you, provide support, and share helpful resources. Now, mental health and substance abuse challenges affect everyone differently, and recognizing when to get help for yourself or offer support to someone else suffering from substance abuse is an important step in obtaining help to cool down a mental health temperature. The Federal Substance Abuse and Mental Health Administration provides, again, a helpline 24 hours a day, 7 days a week. This provides referrals to centers for local substance abuse treatment facilities, support groups, and community-based organizations. While a very ill mental health temperature requires emergent professional help, stay tuned as we discuss a hot or injured mental health temperature next. Amanda?
Thank you, Jennifer. Remember scenario number 2? The individual who's going to work every day, but the intensity of feelings of hopelessness, guilt, and sadness is becoming overwhelming. They're carrying a heavy load, and they were recently evaluated at the local emergency room. They are experiencing medium to severe distress and require professional help, just like when someone experiences a high fever for several days. Does this describe you or someone you know? Next steps for this individual would be to connect with a professional. Join us as we break the stigma associated with mental health by recognizing when help outside of family and friends is needed. Professional resources exist and are available to utilize when your mental health temperature is high. Finding the right professional is easier when you understand the different areas of expertise and training. Family doctors and psychiatrists evaluate, prescribe, and monitor medications. In fact, did you know that as many as 70% of all primary care visits are driven by mental and emotional distress, exhibited by anxiety, panic, and depression, according to the American Psychological Association? Medical providers rule out physical causes for signs of mental and emotional distress, as well as prescribe and monitor medications. Medications improve the symptoms of mental and emotional distress by helping the sections of the brain to communicate clearly again. Finding the right medication is like finding the right key to unlock a door. A medication can take 4 to 6 weeks to fully take effect. Therefore, it's essential to stay in touch with your provider, letting them know whether the medication is working, as well as report side effects. According to the National Institute of Mental Health, a primary care provider can treat mental disorders, particularly through medication, but that may not be enough. Research has found that the most effective treatment plan includes a combination of therapy and medication, especially for depression and anxiety disorders. Therapists help someone better understand and cope with their thoughts, feelings, and behaviors, thereby generating integration of the amygdala and the prefrontal cortex, along with other brain components. These professionals include psychologists, counselors, clinicians, therapists, and clinical social workers. During the pandemic, we've seen health insurance carriers extend mental health assistance. We've seen employers communicate mental health benefits and employee assistance benefits at a more frequent rate. And we've certainly digested so much media focusing on the need to prioritize your mental health and well-being during the last year of uncertain times. A national response to the pandemic is that telemedicine has grown, increasing the availability of therapists, counselors, and other medical providers. While an injured mental health temperature still requires professional assistance, it's not quite as emergent as an ill mental health temperature. Next, Jennifer will explain what it's like when someone is feeling like their mental health temperature is a little off. Jennifer.
Well, it's no wonder mental health professionals are concerned for everyone these days. Natural disasters like floods and major snowstorms on top of a pandemic can lead to significant disruptions in daily routines, social connections, and our normal capacities to respond to stressors. This is perfectly understandable. The communication between the prefrontal cortex and amygdala is disrupted and can cause symptoms like sleeplessness, anxiety, or feeling overcome by uncertainty. Through a study by Mental Health America, individuals noted their top 3 concerns during the pandemic. The top one from April to September of 2020 was loneliness or isolation. The other 2 were past traumas as well as relationship problems. Remember scenario number 3? The person whose partner and married son were diagnosed with cancer. They were also helping aging parents. They were doing okay at work and home, but realized something wasn't quite right. If you or someone you know is experiencing mild distress like this and reacting, I invite you to note the resources you think would be helpful to you or someone you know. It's never too soon to seek help and prevent a mental health temperature from rising. Self-care activities such as talking with family or friends, I would say trusted family or friends, exercising, getting adequate sleep, practicing mindfulness and gratitude may not be enough. Cleveland Clinic experts agree, if self-care remedies aren't enough, it's time to seek professional help. The experts suggest you don't stay frozen or feeling like you're holding your breath waiting for your feelings to be over. A professional can provide new tools to help you keep your cool more quickly and have you feeling your best much sooner. Again, these professional resources include your family doctor, a pediatrician, as well as a mental health professional that Amanda reviewed previously. In addition, you may want to speak with your human resource representative to determine if an employee assistance program is available to you. While a reactive mental health temperature may require more than self-care, a cool mental health temperature can be maintained with self-care activities. Next, Amanda will be keeping things cool for you.
Thank you, Jennifer. Now we're going to spend some time talking about what it's like to enjoy a cool, calm, and collected mental health temperature. First, let's set the stage. In your space, find a relaxed, comfortable position and close your eyes. Simply notice this experience. Notice your breathing. Don't change anything. Simply notice the sensation of the breath in, out. As you focus on this, energizing oxygen is entering your lungs, traveling throughout your body. As you exhale, you release tension from your body, allowing for an even greater sense of relaxation. Thank you for practicing with me today. This is a brief example of mindful breathing. We'll discuss mindfulness in future presentations, but simply put, regular mindfulness is a great way to sustain or regain your mental health temperature. Remember scenario number 4, the individual who has a strong support system, is sleeping well, and has a great sense of humor, even during times like these. They are experiencing a cool mental health temperature. At this cool temperature, you're able to manage your emotions through effective, healthy coping. You're chatting regularly with colleagues, family, and friends. When challenges come your way, you say, I got this. You feel great most of the time, and you really only feel anxious when you're about to deliver a presentation, chat with senior leadership, or are faced with a difficult conflict. Your brain and body are working together to help you face challenges with a sharp mind, bravery, and confidence. You're happy and content with life, and you're actively taking care of yourself and your priorities through healthy balance. You're living your best life and finding time to do things that bring you joy. The expertise of a professional can be valuable. However, there are a lot of things you can do independently to ensure you keep your cool. Dr. Ferre, who Jennifer mentioned earlier, reinforces the importance of regular self-awareness. She states, it's critical to pay special attention to how you're feeling and reacting to any situation and focus on self-care. Checking in with yourself on a daily basis is key. To practice self-awareness and check in with yourself, ask questions such as, how are my food choices? Am I getting enough sleep? How am I challenging my body through exercise? Is my screen time too much? How am I feeling? Am I feeling overwhelmed? How am I connecting to others? What am I thankful for?
Needless to say, we all are experiencing natural reactions like chaotic and distracting thoughts, strong and complicated feelings, and surprising behaviors during these months of the pandemic. And some individuals are more susceptible than others to this disruption between the amygdala and prefrontal cortex associated with a rise in their mental health temperature. People with a personal history of addiction or depression, or folks with a family history of a mental illness. In addition, there could be those who have been affected by a job loss or loss of a loved one, and they all are more at risk for a rise in their mental health temperature. Each of us is in a different situation, and our experiences and circumstances vary greatly. And if your distress is too great and difficult to manage alone, reaching out for support is a wise choice. Let's review the tools available to each of you as you face your own experiences related to the pandemic. Amanda is going to review a well-being and mental health toolkit just for you.
You can use the contents of this kit when you're feeling any temperature, cool, elevated, or experiencing a full-blown fever. We'll review these tools as they play a very important role in keeping your mind functioning at its best, most well-integrated state. First, self-care. I ask you, what are 3 healthy lifestyle behaviors that everyone is talking about these days in terms of self-care? 3 that I can think of off the top of my head: sleep, nutrition, and exercise. They seem to be some of the hot topics. So we know you know they're important. Picture a plant that gets the right balance of sunlight, water, and nutrients. It has a healthy environment and it's able to function at its best. When you provide your body and mind with a healthy environment, you are able to function at your best. Self-care relates to everything from brushing and flossing your teeth, to exercise, to nutrition, to taking a break when you feel overwhelmed. Second, mental health providers. Your primary care physician or family doctor, psychiatrists, and nurse practitioners can all prescribe medications to help manage mental health concerns, while psychologists, licensed clinical social workers, counselors, and therapists all provide talk therapy without prescribing medications. Regardless of the credentials of the professional, or whether you see them in person or via telemedicine, you should have a therapeutic relationship. A therapeutic relationship is a buzzword in the behavioral science space. Simply put, you should feel welcomed, heard, and respected by the professionals you work with. It's their responsibility to understand mental health conditions, listen to your concerns, and offer appropriate evidence-based strategies to address your concerns and help you promote your mental health. You may not mesh with every provider, so keep exploring until you find someone who's the right fit and with whom you can have a therapeutic relationship. Third, just a reminder that helplines exist, such as crisis helplines and crisis text lines, and these are alternatives to seeking professional mental health resources. As you join us for week 2 and 3 of this presentation series, you will be building out your well-being and mental health toolkit. Next, SMART goals. Have you set a SMART goal before? Perhaps your SMART goal was related to stress management or your overall well-being. Today, Jennifer and I challenge you to set a SMART goal for yourself related to keeping things cool so you can enjoy a cool mental health temperature. SMART goals highlight areas of behavior that you want to improve upon. They highlight the vision you create for yourself. This year in particular, goal setting is ever more important. It helps you stay motivated and driven for something more. This inspires hope and positive thinking for the future. Take your general goal, such as I will preserve my mental health temperature, and transform it into a SMART goal that hits all the elements of this goal setting framework. If you need to revisit the SMART goal framework, please visit the resources tab on our Connect Care 3 website for a SMART goals template. We challenge you to write down your SMART goal. Throughout this series, you'll have the opportunity to visit your goals in week 2 and 3. You can add effective and useful strategies to your SMART goal plan.
Yes, SMART goals. They set us up for success, don't they, Amanda?
Certainly.
And I think all of you are listening to this with a SMART goal and with your commitment to keeping your cool. You're making it possible to support your brain, quiet down the amygdala, and strengthen your prefrontal cortex in spite of or because of the fears and anxieties associated with the pandemic and life in general. Your brain function can be integrated, and it is possible to lower your mental health temperature and keep your cool. So thank you for attending week 1 of the Mental Health Matters mini-series. We are looking forward to seeing you again in week 2 next week, March 24th. If you're unable to attend, please keep an eye out on our Connect Care 3 YouTube channel each week for a recording of the presentation. At the end of the Mental Health Matters series, recordings will also be available on the Connect Care 3 website. Thank you again for joining us today, sharing your valuable time, and enjoy a cool mental health temperature.